We've got many directions that we can go to, but I want to focus a little bit on a couple of specific client populations. So the
Okay.
first one, we're talking about individuals with complex disabilities living with substance addiction.
Mm-hmm.
What type of adaptations have you had to make, or uh, with regards to intervention strategies to better serve these populations?
Yeah, even when we say clients with disabilities, that is such a huge range of physical disabilities or mental health concerns would fall under disabilities. And then we also have the visible and invisible disabilities. So when I worked in addictions treatment, we did adapt a lot of our treatment strategies to meet the ability status of our client, whether that was working with a client who had an interpreter because they were deaf, whether that was working with a client who had a visual impairment. When we start looking at some of the developmental delays and then these neurodiversity when it comes to different cognitive ability statuses, we really have to meet our client where they are. And that might mean bringing in caregivers with releases of information to have more people involved in the treatment, to have support around this person. We do a lot of family work when we're working with someone with disabilities. But I would say that I tell my students this too. When you're working with addiction, you're still relying on all of your basic counseling skills, your theoretical orientation, as well as your multicultural and social justice counseling competencies. And so we tailor our approach to the unique cultural identities of our client, whether that's ability status, whether that's socioeconomic status, religion, spirituality, sexual orientation, race, ethnicity, gender. We are taking into account our client's unique cultural identities. We're looking at our unique cultural identities, how they're coming together in session. And then we use intervention strategies that are appropriate for that client in light of their cultural identities. And so I think that we have to do our due diligence to see what does addictions treatment look like with this particular drug of abuse, with this particular client, with this disability or with this cultural identity, and then make sure we're tailoring our interventions. Addictions counseling is not one size fits all. There are lots of ways to long-term recovery. And so there are a lot of different types of support groups and individual counseling, group counseling, family counseling. We can use a variety of methods. And I think it's meeting the client where they are to make sure that they're getting their needs met and that we're tailoring and adapting our strategies to our client. Yeah, there's a lot more I could say about cultural diversity, but hopefully that gives you a little sense of relying on your multicultural competencies.
Very important to get trained in that area too, quintessential.